the expert a question. And before the break we were talking about TMJ. Again, that is the joint where the jaw is?
It's the jaw joint.
Okay.
It's where when you open and close your mouth, if you put your hand in front of your ear, you'll feel a joint that moves when you open and close your jaw. That's a TMJ joint.
And now, if you're having a problem with it, what are some of the signs?
One of the big ones is headache. People wake up, particularly if you wake up in the morning with a headache. That's a real giveaway, because what happens at night when you're sleeping? Well, you're grinding your teeth. That's what happens. And if your teeth aren't fitting, and just grinding your teeth actually can cause a problem. So that's one symptom. The other symptom is your jaw gets stiff. You have trouble chewing, or there's some clicking in your jaw joint, or your jaw joint gets stuck on occasion. All those things are, and sometimes even ringing in the ear will be an indication of a TMJ problem.
I see. What about vision? Would it affect your vision possibly?
In extreme cases, but not in a typical, not normally.
Okay. I was wondering with the dentist, with my dentist who asked me to open my mouth, and he feels on the side of my jaw. I guess that's what he's testing for.
That's right. He's looking for dysfunction. He or she is looking for clicking. They're looking for that your jaw opens smoothly and regularly.
I see. Again, 914-693-5700 if you want to ask the expert a question. I think we have a call. Hi, you're on the air. Where are you calling from?
Hi, yes, I'm calling for Eastchester. I'd like to ask a question.
Okay, what's your first name? What's your first name?
Jane.
Jane. Okay, Jane, what's your question for the doctor?
My teeth are very short in the front, and I wanted to know if there's anything I could do to make them look longer.
Yes, Jane, there definitely is. Now, you know, you can put on what we call veneers. It's like if you think of a fingernail, you know, one of those false fingernails that goes over top of your finger. It just covers the front of your fingernail. Well, in the same way, veneers cover the front of your teeth. So, and you can change the color, the size, the shape, the length. You can go from a bad smile to an extraordinary smile. And they should be customized to what you want, and customized so that they fit your face. It's not, veneers aren't one size fit all. They're not picked out of a box. So, but you can lengthen teeth. In fact, you can dramatically change shapes and directions and crowding and color and more than just length. That would be probably the best way of doing that.
Okay, and then do I have to have them changed like the way they change their fingernails?
No, not at all. They're porcelain. They are bonded in place. They're unbelievably durable. One of the reasons they're very durable is because the tooth, your natural tooth, is behind the veneer. So when you're biting, you're actually biting on your natural tooth, and they're extraordinarily strong. So, no, you do not change them like. That's a very good question, by the way. You don't change them like you would your fingernail. I'm just trying to give you some idea how they would kind of fit on your teeth. But they're custom made to your mouth. A great deal of time is taken to make sure that you pick out and you like the type of teeth and the shape of the teeth that you want. And that can be tried out when you have your temporaries on, because it's a 2 appointment. That's all it takes. Visit. Yep, 2 appointments. And you can go from where you are now to having a wonderful smile.